We actually have, for the exchange, this is specifically the exchange presentation, for the health insurance exchange or the organized marketplace to be set up and functional January 1, 2014, we actually have to have a plan drafted, vetted, submitted to Health and Human Services by the end, and it has to be approved by January 1, 2013. It's going to take them a little bit of time to approve it, so we're working back from here. That means we have about a year and a half to make all the decisions about the design of the exchange to get it up and operational by 2014. If we do not have a viable plan, if we submit it to HHS, if we decide not to do anything, or we submit a plan that is not going to be functional in 2013, then the federal government is going to come in and set up the exchange in 2014. So they need that year to be able to do that if we're not going to do it. What that means is that we as a state have to make a lot of big decisions. We have to decide whether we want to try to design our own exchange, and then we've got to make a ton of decisions in regards to what that will actually look like. Keep in mind that the exchange, there are about 1 million people in the state of Tennessee that are uninsured right now. About 1 in 6 of us here in Tennessee. In 2014, 650,000 of those people are going to get health insurance through the exchange. 650,000 people. January 1, 2014, are going to be eligible to get insurance through the exchange. About half of those people will actually qualify for TennCare, our Medicaid program, and the other half will actually apply. They'll be able to get private health insurance with those sliding scale premium tax credits through the exchange. The reason they would both go through that same portal is, who knows what their federal poverty level is? Nobody. So when we have these two programs that are side by side, everybody's going to go through the same portal, one application process that will channel them to the appropriate program. All right. So why are we talking about a health insurance exchange? Why is that concept incorporated into the Affordable Care Act? I think this is a training issue more than anything. All right. So I talked a little bit before about the large group market and the small group market. The biggest problems in our health insurance system are in the small group or individual market. That's where things are more expensive. Small businesses pay on average 18% more for the exact same health insurance coverage as a large employer. What we're looking at here, this is actually everybody combined. We've got a couple of things. This gray line here is overall inflation. The blue line, workers' earnings. Can y'all see what this orange line is? Health insurance premiums. This is 1999 to 2009. Within a 10-year time frame, health insurance premiums have risen 131%. They're going up it's almost now 4 times faster than wages. All right. The biggest problems are in the small business and individual market. We often say it's broken. It's too expensive, there's fewer and fewer benefits, fewer people are covered, and more of those costs are getting shifted to policyholders. This is what we talk about. You know, in the morning, Brad made a little pitch about stories. This is what Rachel does for us. Is she interviews people who have a particular experience in the healthcare system to help illustrate the problems and the solutions. Can you all see to read that? Want me to read it out loud? Well, we actually got to go, we went and talked with Mark Jacobs a couple weeks ago. This was actually a story that he shared with our story coordinator about 2 years ago. What it says, I'll go ahead and read it in case you can't read from it. Small business owner Mark Jacobs is having increasing difficulty ensuring his aging workforce in the 135-year-old sawmill he runs in McMinnville. Since 2001, the Blue Cross Blue Shield premiums the mill pays for its workers have risen by 100%.
I'm really trying here. Okay. I know, right? It's a little crooked, but I'm going to live with it.
Consequently, healthcare is among the top 3 expenses of this business. Mark maintains that the insurance they provide makes the mill competitive as an employer. Mark shared with us that he made a decision. A couple of years ago, he, under intense financial pressure as the economic downturn took place, and as his sawmill was getting fewer and fewer orders, he had a decision to make. Either he'd keep on his young, low-income Hispanic workforce, or he'd keep on the guys that looked like him, the people he'd been friends with for his entire life, who had dedicated their lives to the sawmill. When he had to lay people off, he made the decision to keep on the folks who had committed to the sawmill and had been there for 20, 30 years. What that did to their insurance premium almost broke his business. What he's been dealing with now is those costs have continued to skyrocket year after year after year. It makes it very difficult for him to keep the sawmill running, for him to keep his workers insured. And I believe, Rachel, do you have an update? Do you remember?
Mm-hmm. So 2 years ago, they had 95 employees. This year, they have 30 employees. A lot of, like Beth was saying, a lot of the employees have diabetes, and they're the ones who are providing health insurance to their families. So he knew that if he laid off these guys, 1, there would be no job for them, and 2, there would be no insurance for them. And the other thing that really was troubling him was that he talked to all kinds of different insurance guys and basically didn't have a whole lot of choice as far as an insurance plan, because most of the agents he talked to were just pitching him the same thing. And I think one of the way he put it was basically every year he either has to pull a rabbit out of the hat and find some way to arrange the expenses so he can keep paying health insurance, or he's just like, guys, you're going to have to take on more of your premium, you're going to have to pay more to get less. And he says that's been happening every year for the last 3, 4, 5 years.
The deductibles have been increasing, the out-of-pocket costs have been increasing, and he's been having to shift some of that cost onto the employees. All 3 of those things are happening simultaneously. It is, not only is it difficult for him and his family, but it is unsustainable for his business. If it continues like this, it's going to close the door on the sawmill that has been in his family and has been open for 135 years. We already talked a little bit about this. 1 in 6 Tennesseans are uninsured. There's often a misconception about this. Most people who are uninsured are in a family where there is at least 1 worker. Most people who are uninsured are from a working family. Most of those people work for a small business. That's a problem. Because all these things that we're seeing, like in Mark's situation, that's where a lot of the uninsured are, is they're family members of small businesses that have stopped offering health insurance because they can no longer afford it. This is a quote that I use a lot when I'm talking to politicians of both parties. And this was former Senate Majority Leader Bill Frist, who's a physician. I think are folks familiar with Bill Frist? Fairly well known. It's not the bill that Republicans would have written. It's not the bill that I would have drafted, but it is the law of the land, and it is the platform, the fundamental platform upon which all future efforts to make that system better for that patient, for that family will be based. And a lot of what he was talking about was the exchange.